Today we are discussing about stroke, which could be called as a brain attack. It's largely because of the block in the arteries of the brain leading to paralysis of the body. This paralysis could be on your face or half of the body or even bigger. As you know, the stroke happens because of two reasons. These blocks could be in situ, as in the process of atherosclerosis, which is responsible for causing heart attacks or peripheral vascular disease or brain attacks, or it could be a thromboembolic phenomena in which any clot from your body travels to the brain and lodges in a crucial artery leading to paralysis. As you know, this is a lifestyle disease in which people who lead erratic life, being obese, having a lot of risk factors like diabetes, hypertension, dyslipidemia, or lack of exercise, having a lot of stress in their body, are the ones who are prone to suffer from a compendium of these lifestyle diseases, which also includes heart failure. Heart failure in particular, because heart failure is one entity which leads to the bad rhythms of the heart, what we call as atrial fibrillation, in which the small chamber of the heart starts fibrillating, and that would predispose to formation of clots in the heart. And when these clots travel from heart to the brain, we call it as a thromboembolic stroke, and it leads to major paralysis in the body. The treatment for this kind of stroke would be giving them anticoagulants so that the clots don't form in the left atrium and then they don't travel to the brain, or treating the heart failure per se. The treatment for heart failure in the modern times, as you know, the last or the apex treatment is heart transplant, which logically is not possible every time, because getting heart from public or people who have been brain dead is really difficult. Short of that, there are very important devices in market called as LVAD or LVSS device. This is basically an artificial heart, and when these hearts are placed into in the heart, they can make you live longer so as to wait for a new heart to come and have the heart transplant done. There are times when you don't get even the new heart, you can lead the rest of your life on just LVAD or LVSS device. The problem with LVSS device is that since it is a motor-based device, you always need a kind of anticoagulant to keep this device moving and keep clots from not forming in the body. So that part is very important as far as stroke is concerned. And as I told you in the beginning, heart failure per se leading to atrial fibrillation would also predispose you to have a thromboembolic stroke. So for these two reasons, one has to be very, very careful and keep a close watch on their heart rhythm if they are ever slipping into atrial fibrillation or irregular rhythms, and thus predisposing them to having a stroke. I must also emphasize, because it is a lifestyle disease, people from the beginning should learn a habit of leading a healthy life, in which they should regularly exercise at least for 45 minutes a day. Any exercise like aerobic or yoga or dynamic exercises. They should avoid eating greasy food or fatty food, leading to building plaques in the brain's arteries or the coronary arteries, leading to premature heart attack or brain attacks or stroke. If they are diabetic or hypertensive, they should control it well. They should refrain from chewing tobacco or smoking, which is a very big risk factor for the young heart attacks or young stroke. And of course, one should lead a life which is having least stress in day-to-day life. So these are some of the remedies which can help you prevent a stroke in your life. And mind you that this is a very, very serious health problem, because stroke is one entity which you may not die because of a stroke, but rest of the life you'll be paralyzed and you'll be vegetative and bedridden, which is a burden on society and family.